Weekend Breakfast. Healthy living.
October is Breast Cancer Awareness Month, specifically Breast Cancer Awareness Month. And so we are encouraged to go and get the necessary screenings. If you qualify for them, your mammograms. We're encouraged to do self-examinations regularly. I think that number is once a month to see for any abnormalities or changes in your body, which you can then take to the doctor. But quite exciting is that there seems to be technology that's going to be helping with the early detection of breast cancer. And that is being done through the Breast Health Foundation in partnership with Phithos Technology. And to tell us about this new technology, we are joined on the line by the COO of Breast Health Foundation, Louise Turner, joins us this morning. Louise, a very good morning to you.
Good morning, Gugu. How are you?
Very well, thank you, Louise. Thank you so much for joining us this morning.
Absolute pleasure.
So, Louise, tell us about the work of the Breast Health Foundation. When was it founded? What does it aim to do?
So we were founded in 2002, and our primary functions are education awareness around breast health and breast cancer in particular. And we provide informative and psychosocial support to anyone affected by breast cancer, whether it is the patient going through treatment and or the caregivers and family supporting the patient.
Mm-hmm. And so with regards to the psychosocial support, what kind of challenges were you finding, people who had been diagnosed and received a positive diagnosis for breast cancer? What kind of emotions, feelings, experiences did you find they were going through that needed this psychosocial support?
So firstly, the whole team at the Breast Health Foundation, we are all breast cancer survivors ourselves. So we've all been through that process of finding a lump, going through the process of getting to see a doctor, whether it's in public or private. Public healthcare is a challenge in our country, as you may know. So we've been through that process of seeking out a clinic and then going to a government hospital, going through mammograms, waiting for results, getting a positive diagnosis, and then sitting with, oh my goodness, I've got breast cancer, what now?
Mm-hmm.
So, being women, we don't always look after ourselves first. We're always looking after the family first. And now we've been told we have breast cancer. So from an emotional point of view, there are so many things that you've got to think of. As women, losing our hair, our femininity, it's our breasts. We might lose our breasts. So there's a whole lot of challenges regarding that. Then, of course, there's actually you're healthy and now you've got to start chemotherapy. And there's a lot of side effects with chemotherapy. You're getting sick, you're off from work, you've got nausea, you have other side effects that you've got to manage through the 6 months odd you're on chemotherapy. So from a support point of view, it's not only the emotional side of the fear, the anxiety, the anger possibly, and of course all the other things that go with your femininity, etc. But it's also managing your side effects.
Yeah.
So we are there as a support structure to help you from managing your side effects, managing your emotions. We have WhatsApp groups where we have 50, 100, 150 patients on the group, and they all support each other as well. So you find on the group, morning, I'm at chemo, who's at chemo today? I'm here, and then they become friends and they become chemo buddies in the chemo room and they start supporting each other. So it's an extended family that gets created with everybody on treatment and they start supporting themselves in the chemo room.
Yeah.
So it becomes an extended family where you have other people going through treatment who support each other. And then, of course, the people at home. You'll find hubby phoning or sister phoning. How do I help her? What can I do? And it's the practical things, when it comes to the caregivers. Help them cook the meals, help them pick up the kids from school. So there's such a vast range of things that we can help with and support you with, and the caregivers as well. Just practical support while the patient's going through treatment.
One of the fears for a lot of people is finding out. So some people are afraid to go get checked, whether it is, there is a lump and they're afraid to go for the mammogram, which might tell them whether, it is something that is a cause for concern, or men being afraid to go for, their prostate examinations. There is this fear around, if I do my self-examinations, find a lump, then it's definitely cancer, or, I'm not going to be able to deal with it. And how do we help more people, I guess, move past that fear of examining themselves, getting checked out, and hopefully being detected early if it is cancer? Because there does seem to be, just a fear from a lot of people of knowing the truth.
Look, cancer's scary, let's be honest. And in South Africa, we have this mindset of cancer is a death sentence because, and this is unfortunate, our healthcare system is a challenge, and a lot of women present with late-stage cancers because accessing healthcare is difficult sometimes, and because of the fear. They wait and wait and wait and wait until it becomes painful and all the symptoms are really bad, and they get diagnosed late, and obviously late diagnosis is a challenge, and they might pass on because it has already spread. So that fear of late diagnosis and, the lady down the road got diagnosed and she passed away is just exacerbating the misconceptions that cancer is a death sentence. So it is better to not better to find a lump, but it's better that when you find the lump, you access treatment early, because I'm a 20-year survivor. I had breast cancer in 2004, and my entire team, we're all heading for 7, 8, 12-year survivorship.
Yeah.
So, we are the epitome of survivors. So hopefully we're a beacon of hope to our patients that, breast cancer isn't a death sentence. We need to start changing the mindset of the people out there that you can survive a cancer. It's about getting you in to have your screening and getting you in to be tested. And 9 out of 10 lumps are not a cancer. It could be something else. It's just getting our patients and our ladies in our country to go and have it checked out, because 9 out of 10, it's not a cancer. So rather know that it's not a cancer. And then if it is a cancer, get treatment early, because with current medicine and current technology in the medical field, most women are surviving breast cancers because they're getting treatment early.
Yeah. And speaking of early detection, so Breast Health Foundation has partnered with Phithos Technologies to offer quite an innovative tool to help women assess and hopefully, start that journey of, the early detection of breast cancer. Tell us about this collaboration that you have with Phithos Technologies.
So this is the first in the world, and I'm really excited about it, because health literacy is a challenge, okay? We all think we know a lot about breast health, but when you start answering these questions in the assessment, it's easy questions. You're not writing an exam. It's just questions, basic questions. How often do you check your breast? Every day, once a week, once a month, once a year? Never. And it asks questions like that. And at the end of answering these questions, it gives you a personalized report on your answers. So if you answer, I check my breasts once a week, it will say to you, well, you should actually check your breasts once a month, 7 days after menstruation. These are the reasons why you need to start mammograms from the age of 40. And it gives you the correct medical answers according to the questions and how you answered the survey. So it gives you a detailed breakdown of the information you need to know about breast health. It gives you your screening, when you should be screening. It also covers the myths and misconceptions around breast health. One of the things is cell phone in your bra. Does it cause breast cancer? No, it doesn't. And it breaks that down in the myths and misconceptions, because A lot of women in our country think that the microwave or a cell phone in your bra could cause breast cancer. No, it can't. So it gives you a 3-4 page personalized report on your breast health knowledge with all the answers, as well as how to do a breast self-examination, as well as the signs and symptoms of breast health issues that you need to go and see a healthcare professional for, so that they can actually do a clinical breast exam and refer you if needed.
Yeah. And
you
so,
can do it in the privacy of your own home.
Mm-hmm. And so, unlike, especially during this time of the year, we do get a lot of information. There are campaigns to encourage people to, assess themselves, go for another check if they, find a lump or something abnormal. This sounds as if it is quite specific to where you are. It will be specific to the kinds of questions, information gaps that you might have. So it's not the information is not general.
It's not general. You know what we do, and I think this happens all over the world. Breast health and breast cancer is quite medical, and we as organizations break it down to layman's terms, but we do base it on what the doctors tell us to educate on. And it's medical. The doctors say these are the signs and symptoms, and this is what you need to educate all the women on. And in South Africa, in particular, with our multicultural country, there are so many things that we don't educate our women on because it's not medical. It's not what the doctors tell us to educate on. And we have found over the years there are so many gaps where we're not educating our women because they don't ask us those questions in groups because they're either embarrassed to, or they're not sure, or they don't want the woman around them to know that they don't know these questions or these answers.
Mm-hmm.
And by doing this on their own, they can ask those questions without being embarrassed. And this assessment covers all of those. And what we hope to do when we've done this assessment in the next couple of months is take the information from it and change how we educate our women in the country and start taking these things like underwire bras or cell phones in your bras and incorporate that into our education so that we can educate not just the medical side, but also incorporate the myths and misconceptions so that we educate our women around the country on things that they hear in the communities and think are problems around breast health and change so that the health literacy in those regions can be addressed and we can educate them in a way that they understand better.
And so the platform, which is called Philaxis.ai, is it a mobile platform? Is it online? So you'd use it either on your desktop, or your iPad, or tablet, or your laptop. How do you access the platform?
So you can go onto any of our social media or directly onto the website. It's a one-source, so you only do it once. It's not an app. So you can go either onto the Philaxis website or the mybreast.org.za website. There's a QR code. You click on the QR code. It takes you into the platform. You use your cell phone number. You get an OTP. You go into the platform, do the assessment, and then you'll get a personalized report sent to your cell phone. You can access at any stage.
Is the platform currently available in just English?
It is in English. We will be launching Zulu and Afrikaans and Sotho shortly.
Mm-hmm. Okay. So you only need to do it once?
You only do it once.
Okay.
Because it will then give you all the information that you need to know from your answers.
Okay. A WhatsApp message here from Merle who says, "Morning, ladies. I had a lump in my breast and my medical aid wouldn't pay for my mammogram because I had a mammogram the previous year and they only pay every 2 years." And she says, "Love your show." Thank you, Merle. But I guess that's the other challenge as well. So someone like the listener doing the self-examination, finding that there is a lump, but then almost being penalized for having been good about getting the mammogram the previous year and then not being able to get it the second year. I imagine that's also one of the challenges in accessing healthcare.
Okay, so my advice to Mel is that she needs to get her GP to do a referral. And with the referral letter, she should get a approval to get the mammogram done because of the referral that she's symptomatic.
Okay, so she just goes to her doctor and says, I found this lump. Would the doctor also need to do an examination themselves? I guess they would need to.
Would. Yes, he would.
Okay.
He would. That's the thing. You need a referral in cases like that where you're symptomatic, and with the referral, she should be able to get her medical aid to cover.
Louise, we were speaking right at the beginning of our conversation about how the Breast Health Foundation has almost been able to create this community for, women who've come to the organization, women who are now, part of the organization, to also connect them to other women for support, for information. If someone's looking to find out more about the foundation, how they can potentially use the foundation and its network, how does someone go about doing that?
So there's two options. You can either send us an email. You can email support@mybreast.org.za, or you can call us on our share call number. It is 0860 283 343. And then one of the navigators will answer and then chat to you and get you linked up. We have navigators around the country, so you either link up to a navigator nearest to you, or we will include you on one of the WhatsApp support groups and then take it from there, or we will provide you one-on-one support during the course of your treatment and also include you on the WhatsApp group so you can have group support.
Yeah.
We also host webinars online, and we've got quite we love working with the doctors, but the doctors are mostly specialists like oncologists and surgeons. But they give talks, and you sit and listen to the talks. And we've decided this year we don't want to listen to the doctors. We want to ask them questions. So we do quiz night with the doctors every 5 or 6 weeks, where the patients and our buddies give me a list of questions, and we pose those questions to the doctors. And it's actually become quite a fun night because the doctors get 30, 40, 50 questions, and then they answer the questions for us instead of the doctors giving us a lecture. So we have quiz night with various specialists every couple of weeks, which is available. You'll pick it up on our Facebook page when we're having the next quiz night.
Mm-hmm.
That's also a nice support structure, so patients can tune into that. It's live teams. It's also available on YouTube, so there's quite a few on YouTube. So you can follow us on the social media channels as well if you don't want to be actively involved in support groups and WhatsApp groups.
I also see that the Bosom Buddies, I guess part of the work that you do, not only provides emotional support to women, but also men who are affected by breast cancer. So men who are currently either undergoing treatment or have just received diagnosis can also reach out to the Breast Health Foundation.
Yes, the men are strange because men don't like to acknowledge that they have breasts and can have breast cancer. Mm. So there are a lot of men out there. One of every 100 diagnoses of breast cancer is actually a man. But the men don't like to acknowledge that they've got breast cancer. But yes, they can reach out to us, and we do support them. Men are also at risk of breast cancer, but it's not as common as women with breast cancer. So they can reach out to us. We do have a couple of men out there who do provide support to other men going through breast cancer. So they can reach out to us as well, so we can assist them through their journey.
Louise, I must thank you very much for your time this morning. It's been great having you on the show.
Thank you very much, Gugu, and have an awesome Sunday.
Thank you so much. You too. That is the COO of Breast Health Foundation, Louise Turner, joining us for our Healthy Living.